I want to give you an update about what's happening in the only federal prison in Ohio. This is a place called the Elkton Federal Correctional Institution. It is located in Columbiana County. It is a federal prison. It houses federal prisoners. It is not run by the state, and it houses federal prisoners and not state prisoners. We know that 7 inmates have tested positive. We also know that dozens more have shown symptoms, and some of these very serious. 3 inmates have died. Over the weekend, on Friday and Saturday, I started getting calls about what was going on at Elkton in Columbiana County from local officials and others who were concerned about that. We started looking into this. I asked the Ohio National Guard state surgeon to visit the Elkton Prison. And the Guard came back to me, as well as our health department came back and said there is no doubt that this prison needs help. The head of Ohio National Guard, General Harris, tells me that Elkton's medical staffing right now is at only 50% of what it should be. And for every federal inmate at the hospital, they need 2 federal guards standing watch. And some of these prisoners are now out in the community at these hospitals. Now let me again, excuse me, say it. This is not a state facility. It's a federal prison run by the Federal Bureau of Prisons and the United States Department of Justice. It houses federal inmates from all over the country who are sentenced in federal court. But this prison is in Ohio. It is staffed primarily by Ohioans, our fellow citizens. Their families live there, live in the area. When an inmate gets sick, these inmates are, of course, transferred to local hospitals out in the community. So that is why today I am announcing I've authorized the Ohio National Guard to go into Elkton Prison to assist. This is very limited. It's limited in duration, and it's limited in scope. We have received today a formal request for assistance, and right now the plan is to go into the prison for 7 to 10 days until more federal assistance arrives. We have an advance team from the Guard there today, and we're prepared to send at least 26 guardsmen and women to the prison to help in the Elkton Infirmary. This is a medical mission only. The Guard members will not be armed. They will not be providing security. They'll be there to assist with non-COVID cases, as well as those who are showing symptoms of this highly contagious, deadly disease. These soldiers, who all work in the medical field, will have N95 respirators for protection while they work to augment the current prison medical staff. They will treat those they can while triaging others with serious symptoms for hospital care. The Guard also stands ready to help with transporting the seriously ill patients to the hospital in the event of a surge. In addition to the staff, the Guard will be bringing equipment as well as ambulances with them as well. As I've said, we've all said, we're all in this together, and providing state help for this federal prison is the right thing to do. In the meantime, however, I do feel that the U.S. Department of Justice and the Federal Bureau of Prisons should stop any intake going into that prison for any reason. And I specifically made that request last night on the telephone, a call about 9 o'clock at night with the head of the federal prison system. That's something that we feel very, very strongly about. When an outbreak inside the prison takes place, it's certainly not the time to introduce new inmates to that population. Additionally, we've been receiving calls from family members of inmates at Elkton asking us to release the federal prisoners. Let me be very, very clear. We do not have that authority. This is a federal prison. I have no authority in that area.